As a new parent, you do anything to take care of your kids. But what about your care? A bipartisan group of lawmakers is pushing to expand Medicaid for postpartum Wisconsin mothers. News Channel 7's Sloan Wick spoke to a co-author of the bill today. Sloan, how does the state's postpartum Medicaid coverage compare to other states?
Dale, Wisconsin is one of only 2 states not to put in a Medicaid extension. It's just us and Arkansas. What we offer is shorter term than almost anywhere else in the country.
60 days just isn't enough time.
60 days. That's less than half of the NFL season, 2/3 of the time period you can make a return at Target, and how long after giving birth Wisconsin women are insured Medicaid coverage.
The period immediately following birth, especially the first few months, are a time of some high risk for some women. The expansion would allow better access to health care during what can be kind of a vulnerable time.
Dr. Lisa Hansen worked with patients for 30 years and is now the Associate Director of Marquette University's Nurse Midwifery Program. She says healing after birth is a long-term process.
Most women will say that it takes a good year before they feel like themselves.
That's why Representative Patrick Snyder of Weston co-authored a bill to expand postpartum Medicaid to 1 year.
But we have to take advantage of getting the medical care out to these women and make sure that they're there for their baby, because if they would die, that's already trauma being put into that baby's life.
Wisconsin DHS data shows the severe maternal morbidity, or SMM rate, increased significantly between 2016 and 2023. That's the amount of women who have unexpected outcomes of labor that result in significant consequences to their health, often after the 60-day mark.
A lot of times there are deaths between 5 and 9 months. And what I mean by that, when they break down the numbers for the white women, it's suicide, the top cause of death. And for Black women, it's cardiovascular or preeclampsia, the high blood pressure.
The idea that an individual that's given birth can access their provider is very important so they don't fall through the cracks or ending up in an emergency room.
The bill could go to the Senate as soon as next week. Representative Snyder says he wouldn't be surprised to see it pass before the end of the month.
Sloan, if this bill becomes law, what are we talking about the financial impact being?
Dale, that's the natural question. Lawmakers don't have an exact number yet, but say it will likely be between $7 and $15 million. That won't all fall on the state, though. Representative Snyder says the federal government would help with some of the costs.